Thank you, Christy. And welcome to Section C Cognitive Patterns Workshop. I'm not so sure that you guys can see me there, but I'm here. Anyway, as a brief introduction, I am a registered nurse with experience in acute and post-acute direct care, nursing education, and quality management, specifically in the home health setting. And currently, I am a senior staff associate at Econometrica in Bethesda, Maryland. So hopefully most of you reviewed the recorded webinar training for Section C. I know it was a lot, but this is to help get us ready for the coding. And to help highlight that a little bit, I am going to look at some of those elements, and we'll start with looking at the intent. So the intent of Section C is to determine the patient's attention, orientation, and ability to register and recall information, and if the patient has signs and symptoms of delirium. And with this presentation, we will practice exactly that. So the Section C items for this coding workshop include C0100, should the brief interview for mental status C0200 through C0500 be conducted? C0200 through C0500, the brief interview for mental status, the BIMS, and C1310, signs and symptoms of delirium, taken from the CAM. So in order to help you with the coding of these scenarios, I invite you to access the data sets for your setting. Now, these can be found on the HUBA platform under the resource tab. And within that tab, click on documents where you'll find the PDF versions for your settings item set. So for the IRF-PAI, Section C items can be found on page 7 and on page 7 for LCDS as well. So take a minute to access those as we move through this presentation. So let's start with C0100. Should the brief interview for mental status C0200 through C0500 be conducted? The response codes for C0100 are as follows. Code 0, no, if the interview should not be conducted because the patient is rarely never understood, the patient cannot respond verbally, in writing, or using another method. An interpreter is needed but not available. And skip C0200 through C0500. Code 1, yes, if the interview should be conducted because the patient can be understood verbally, in writing, or using another method, an interpreter is available if needed. Then you will proceed to C0200, repetition of 3 words. And remember, we should attempt to conduct this interview with all patients. So for our first practice coding scenario, after a short acute care hospital stay, a patient is admitted to your post-acute care facility. They cannot speak and they communicate using sign language. They appear to be withdrawn when asked questions. A sign language interpreter is available to assist with communication. Using the interpreter, you find the patient consistently understands your questions and directions, though sometimes the patient is hesitant to respond. So how would you code C0100 for this patient? Is it A, code 0, no, as the patient cannot express themselves verbally, or B, code 1, yes, as the patient using an interpreter can be understood, or C, use a dash as the patient is withdrawn and hesitant to respond to questions? So I'll give you a few seconds to think about your answer. You'll see the poll come up. And you just need to kind of think about how is that patient responding to this? And I'll give you guys a few more seconds here. And let's go ahead and close those polls. And it looks like most of you thought it was code 1, yes, as the patient is using an interpreter. So let's see what the actual answer is. And the correct answer is 1, yes, as the patient using an interpreter can be understood. So the rationale, let's consider that the patient did require an interpreter to communicate, and one was available. When communicating with an interpreter, the patient was indeed understood. Okay, now let's look at C0200 through C0500, brief interview for mental status, the BIMS. We'll start by reviewing the steps for assessment that we covered in the recorded webinar. First, the interview any patient not screened out by C0100 should the brief interview for mental status be conducted. Conduct the interview in a private setting if possible, and be sure the patient can hear you. Sit so the patient can see your face, and provide an introduction before starting the interview. such as, I would like to ask you some questions. We ask everyone these same questions. This will help us provide you with better care. Some of the questions may seem easy, while others may be more difficult. If the patient expresses concern that you're testing their memory, reply, we ask these questions of everyone so that we can make sure that our care will meet your needs. Directly ask the patient each item in C0200 through C0400 in one sitting and in the order provided. If the patient chooses not to answer an item, accept the refusal and move on to the next question. Okay, let's consider this scenario. A nurse is preparing to perform the BIMS interview on a patient after completing the screening question C0100. The nurse finds a private setting and ensures that the patient can hear. They sit in front of the patient, telling the patient they need to complete a mental status interview. The patient expresses concern that their memory is being tested, and the nurse explains that this interview is conducted with all patients admitted to the facility. The nurse asks the questions in the order listed. However, the patient expresses hesitancy and refuses to answer some of the questions. In response, the nurse accepts the refusal and moves on to the next question to complete the interview. So let's think about how that whole scenario played out. And in thinking about that, what step for assessment was not completed by the clinician? Now, was it asking the patient to use the bathroom before starting the interview to minimize interruptions? Was it B, providing an introduction to set the tone and help the patient understand the interview? Was it C, addressing the patient's fears about the memory being tested? Or was it D, restating the question and exploring the patient's hesitancy to answer some of the questions? So the polling has popped up, and I'll give you guys a few seconds to think about your response. And again, this is about a step for assessment that was not completed by the clinician in that scenario that we just provided. Okay, with that, let's see what we wound up with. So some of you thought it was B and some of you thought it was C. So we're going to go ahead and close that up and consider what the right answer is here. And that correct answer is indeed B. Providing an introduction to set the tone and help the patient understand the interview. The rationale behind that is the nurse told the patient they needed to complete the mental status interview, but did not provide an actual introduction to the assessment. And if you remember, we actually had that suggested language for you. The steps for assessment do not include an explanation regarding bathroom use to minimize interruption. And as the patient refused to answer some of the questions, the nurse responded appropriately by accepting their refusal and then moving on to the next question. And the nurse did actually address the patient's fears about having their memory tested. So they did most of those steps, but that one about providing the introduction was missing. So a big important step to remember. Okie doke, so we're gonna do something a little different here. We're gonna do some practice coding for C0200 through C0500 using a video scenario. And this video scenario is for Mr. Crocker. So let's review these activity instructions. We'll start by watching a video segment of the BIMS assessment for a patient, Mr. Crocker. Then you will code the BIMS assessment using the Section C items found in the data set that I asked you to access. And as a friendly reminder, the Section C items are on page 7 for both the IRF-PAI and the LCDS. Now, as you review the video, reflect on Mr. Crocker's responses to help you answer the coding scenario questions. The BIMS assessment of Mr. Crocker has been broken into segments to allow for easier coding of each item. So then you're going to code the answers, and then the rationale will be reviewed. And now for the purposes of this training, we'll be showing the LTAC care data set. And the IRF-PAI version of these items is essentially the same with the coding responses in the reverse order. So just note that for my IRF-PAI friends. Okie doke. So we're going to go ahead and get started with the video.
A nurse is interviewing Mr. Crocker, who was recently admitted. For this coding scenario, the date is Monday, March 2nd, 2020.
Hi, Mr. Crocker. How are you doing? May I have a few minutes of your time?
What? What do you need?
Can you hear me?
Hang on. Gotta get my hearing aid. There. That's out of the way.
Better?
I can hear you fine. What do you want?
I'd like to ask you some questions. We ask everyone these same questions. This helps us provide you with better care. Some of the questions may be very easy, while others may be more difficult.
Okay. That'll be fine.
I'm going to say 3 words for you to remember. Please repeat the words after I've said all 3. The words are sock, blue, and bed. Now tell me the 3 words.
You want me to say sock, blue, and bed? Really?
Yes, that's right. The words are sock, something to wear, blue, a color, and bed, a piece of furniture.
Okay, can we be done now?
Okay, so now we're going to code C0200 repetition of 3 words. So how would you code C0200 repetition of 3 words for Mr. Crocker? Let's review the coding responses on this screenshot of C0200. Would you use 0, none, 1, 1, 2, 2, or 3, 3? And I see the polling has come up. I'll give you guys a few seconds to consider your responses. And remember, these are the repetition of those 3 words for Mr. Crocker. Okay, so most of you thought it was 3. And the correct answer is 3. So well done, everyone. Mr. Crocker stated all 3 words as a question, and this was his first attempt. The way the words are stated by the patient doesn't affect the coding. So well done, everyone. So now let's still take a look at the next part of the scenario for coding temporal orientation. And remember, for the purpose of this scenario, the date is March 2nd, 2020.
I have a few more questions to ask. I need no more than 10 minutes of your time.
Okay, what else do you need to ask me?
Mr. Crocker, can you please tell me what year it is right now?
Why are you asking me that? Are you testing my memory? I'm fine. I don't have Alzheimer's.
I understand that you're concerned. We ask these questions of everyone so we can be sure that our care will meet your needs.
So you ask everyone these questions? You're not just doing a special test on me?
No, Mr. Crocker. We just want to be sure that our care meets your needs. Okay, can you tell me what year it is right now?
It's 2020.
And what month are we in right now?
It's February. My wife and I just celebrated our anniversary last week.
That's wonderful. How many years have you been married?
Ethel and I celebrated 42 years at the finest restaurant in town. Unfortunately, I ate the wrong thing and wound up in the hospital for a few days. That's why I'm here talking to you now. But enough of those regrets. Let's continue on with the questionnaire.
Okay, what day of the week is today?
Geez, I lost track, but I think it's Saturday or Sunday.
It's Monday, March 2nd, 2020. It's easy to lose track of the day when your routine has changed and you're not feeling your best.
Okay, now let's look at the coding for temporal orientation. We'll start by coding C0300A, able to report correct year. How would you code this item for Mr. Crocker? Would you use code 0, missed by greater than 5 years or no answer? 1, missed by 2 to 5 years, 2, missed by 1 year, or is it 3, correct? I'll give you a few seconds to consider your response. Okay, so we'll close the poll. Everyone thought it was correct. And the answer is 3, correct. But before we discuss the rationale for this, let's continue coding C0300. Moving on to C0300B, able to report the correct month. And now, how would you code C0300B, able to report the correct month for Mr. Crocker? Is it 0, missed by greater than 1 month or no answer? 1, missed by 2 to 6 days, missed by 6 days to 1 month, or is it 2, accurate within 5 days? And again, the polling has come up, so take a few seconds to consider your answer and check the circle. Okie doke, let's see how we did. And some of you thought it was from, it was 1 missed by 6 days to 1 month, and then some of you thought it was accurate within 5 days. Well, the correct answer is indeed 2, accurate within 5 days. Now, again, let's finish the coding by completing C0300C, and then we'll review the rationale for the responses here. So how would you code C0300C? Able to report the correct day of the week for Mr. Crocker. Is it code 0, incorrect or no answer, or is it 1, correct? Okie doke, this is pretty easy, yes or no here. Let's see what we wound up with the responses. Looks like most of you thought, 96% thought it was incorrect or no answer. Okay, let's take a look at that answer. So the answer is indeed for C0300C, 0, incorrect or no answer. So let's review the coding rationale for these items. The correct code for C0300A, able to report correct year, would be 3, correct, as Mr. Crocker reported the year to be 2020. The correct code for C0300B, able to report the correct month, would be 2, accurate within 5 days. Mr. Crocker reported that the month is February. He correctly reported the month within 5 days, even though the correct month is March. March 2nd minus 5 days would indeed be February 27th. So that's why that answer would be correct. The correct code for C0300C, able to report the correct day of the week, would be 0, incorrect or no answer. Mr. Crocker responded that the day of the week was Saturday or Sunday. As the day of the interview was Monday, March 2nd, this would be an incorrect response. Okie doke. So let's take a look at the last part of this coding scenario video for coding C0400 recall for Mr. Crocker.
How many more questions?
Only one more. You won't miss the weather report. Let's go back to an earlier question. What were the 3 words that I asked you to repeat?
Really? You want me to remember the words bed, blue, and I don't know. Can we be done now?
One word was something you wear.
Sock. Yes, right. Sock. The other word was sock. Sock was the other word. Are we done now?
Yes, Mr. Crocker. I'll review your discharge paperwork from the hospital, and you can catch up on the weather, and let me know if we're getting snow tomorrow.
Okay, will do.
Okay, now let's take a look at the coding for recall. We'll start by coding C0400A, able to recall sock. So how would you code this item for Mr. Crocker? Would you use code 0, no, could not recall, 1, yes, after queuing something to wear, or 2, yes, no cue required? And I see the polling boxes come up, so feel free to choose your answers. We really appreciate everyone responding and participating in this. We're really hoping you guys are finding this helpful. Okay, and the correct answer is, or what you guys thought the correct answer was 1 yes after queuing something to wear, with 95% responding there. That's wonderful, as the answer is indeed 1 yes after queuing something to wear. Now let's continue with the coding of C0400 recall before we get into the discussion of the rationale for this response. So how would you code C0400B, able to recall blue, for Mr. Crocker? Would you use code 0, no, could not recall, 1 yes after queuing a color, or 2 yes, no cue required? Now remember, this is about recalling the word blue. Okie doke, maybe let's take a look at those responses. Okay, great. 96% thought it was yes, no cue required. And indeed, that is the correct answer. No cue required. Let's go ahead and complete the coding of C0400 recall. How would you code C0400C, able to recall bed, for Mr. Crocker? Would you use code 0, no, could not recall, 1 yes after queuing, or 2, yes, no cue required. Okie doke. Let's maybe take a look at those responses and see how you guys did. Okie doke. It looks like most of you thought it was yes, no cue required. 94% reporting that response. And indeed, the correct answer for C0400C, able to recall bed, is 2. Yes, no cue required. Now let's take a look at the rationale for the coding of this entire item. The correct code for C0400A, able to recall SOC, would be 1, yes, after cueing something to wear. Mr. Crocker reported that he couldn't remember that word, and a cue was provided. After hearing the cue, Mr. Crocker correctly stated the word SOC. The correct code for C0400B, able to recall blue, would be 2, yes, no cue required. Mr. Crocker reported the word blue when asked to recall the 3 words. The correct code for C0400C, able to recall bed, would be 2, yes, no cue required. Mr. Crocker reported the word bed when asked to recall the 3 words. So let's look at the coding for C0200 through C0400 to consider the answer to C0500, the BIMS summary score. Mr. Crocker's responses were coded as the following. C0200 was a 3, C0300A a 3, C0300B a 2, C0300C a 0, C0400A a 1, C0400B a 2, and finally C0400C a 2. And remember, as the name suggests, the BIMS summary score is exactly that, a sum of their responses. So what is Mr. Crocker's BIMS summary score? Now, is the summary score A, 13, B, 8, C, 15, or D, 11? And maybe we can take a slide, go back a slide so they can see all those responses. Thank you. Yes, there is math involved. Sorry to say it, but there is. Okie doke. So with that in mind, let's see how you guys scored on this item. So most of you thought it was 13 at 98%. And indeed, the correct answer is 13. And as I mentioned, to calculate the summary score, you would add the scores for all the questions, C0200 through C0400. For Mr. Crocker, those scores added to a total of 13. So that's how you would populate that response. Okie doke. So now let's engage in another practice coding scenario for the BIMS using a video. However, this time you will use that video to also code C1310, signs and symptoms of delirium, from the confusion assessment method, known as the CAM. So for this activity, you will start by watching a video of the BIMS assessment for a patient by the name of Mr. Miller. And like before, you will code the BIMS assessment items using the Section C items found in the data sets that I asked you to access before. As you view the video, reflect on Mr. Miller's responses to help you answer the coding scenario questions. Now, this video will depict the entire BIMS assessment as a whole, reflecting a realistic experience in conducting the interview. And remember to also note the patient's behavior during the BIMS assessment. This will help you in the coding of C1310, signs and symptoms of delirium, which you will code immediately after coding the BIMS. So I'm going to restate that one more time. We're going to show the entire video, and then you're going to code the entire BIMS and the entire CAM. So again, the idea here is to give you guys a realistic experience, because you wouldn't be necessarily stopping and writing down all your answers and that kind of thing. You would actually be engaging in that interview as an entity, and then go back and reflect and figuring out what those answers would be. Coding answers and rationale will be reviewed. So Mr. Miller. Mr. Miller has been newly admitted to a PAC facility, and a nurse is completing Section C of an admission assessment that includes C0200 through C0500 and C1310. The scenario begins with Miss Miller confiding in the nurse regarding some of her concerns about her husband, Henry. The scenario continues with the clinician conducting the interview to collect data to inform both the BIMS and the CAM. And I encourage you all to take notes or go ahead and code C0200 through C0500 and C1310 as we watch the assessment of these Section C items. Now, I know that's a lot of coding while you're watching, but we wanted to provide, again, that authentic experience that reflects the real life situation of coding items like this. So I hope you guys enjoy this. Here we go.
Let's watch a nurse interview Mr. Miller in order to accurately code the BIMS and CAM cognitive assessment. It's important to note that for this coding scenario, the date is Tuesday, March 10th, 2020.
Ruth, before you go in and talk to Henry, can I have a word?
Yes, Mrs. Miller. What's on your mind?
Well, Henry has had quite a setback, and I just don't think he's the same. You know, like in his mind, he's very distracted, and sometimes he can't focus on what we're talking about.
Yes, I reviewed his medical records and saw some mention made of that. Can you tell me how long this has been happening?
He was fine when he went into the hospital, but in the last few days, I've started noticing these changes. Is he going to be okay? I am so afraid.
Let me start by doing an assessment and getting some more information. Once I have a better idea of how he's presenting and any recent changes, I may have a better sense of what's going on. I can see that you're concerned, and we will do our very best to take care of Henry.
Okay, then. Let me go with you. I may be able to help. Henry? Henry, the nurse is here. Her name is Ruth. She's going to ask you a few questions.
Hi, Henry. How are you? I have a few questions that I need to ask you.
Yes, of course. Please have a seat.
Thank you. Can you hear me all right?
Yes. I can hear you just fine.
Oh, he can get absorbed in reading the newspaper.
Well, I would like to ask you some questions. We ask everyone these same questions. This will help us provide you with better care. Some of the questions may seem really easy, while others may be more difficult.
Well, all right. Go ahead.
I'm going to say 3 words for you to remember. Please repeat the words after I've said all 3. The words are sock, blue, and bed. Now, tell me the 3 words.
You mean bed, sock, and blue?
Yes, that's right. The words are sock, something to wear, blue, a color, and bed, a piece of furniture. Henry? Henry?
Henry, please pay attention to Ruth. I've seen him get like this a few times since he was discharged from the hospital. I don't know why he can't pay attention. He's really not like this usually.
Oh, what was that?
Henry, can you please tell me what year it is right now?
Sure. It's 2016.
Okay. And what month are we on right now?
It's cold outside, so it's winter.
Oh, he's so confused. He wasn't like this 2 days ago. His medication's changed, and ever since then...
I understand. Let me finish the interview, and then we can talk more about your concerns.
Oh, okay. Yes, let's do that, please.
Henry, what day of the week is today?
Well, it says right here that it's Tuesday.
All right, let's go back to an earlier question. What were those 3 words that I asked you to repeat?
Bed,
Mr. Miller?
did you read the story about the Yankees? It's here in the paper. It's an incredible story. Yankees.
Mr. Miller? Henry?
Yes, of course.
One word was something to wear.
Oh, it was socks.
Yes. And one word is a color.
I don't remember. Red, green, yellow, orange, blue, blue birds, blue bonnets, blue jays. The Blue Jays play the Yankees. We saw the Blue Jays play the Yankees. Remember that, Gladys?
Yes, Henry, that was a fun time.
Okay, Mr. Miller, I think I'm all set. Gladys, would you like to talk more about your concerns around Henry's medication?
Gladys, I'm tired. I want to go back to bed.
Sure thing. Let me just get you settled, Henry, and then Ruth and I can chat about a few other things.
Okie doke. So we'll start with coding the BIMS for Mr. Miller. So how would you code C0200 repetition of 3 words for Mr. Miller? Would you use code 0, none, 1, 1, 2, 2, or 3, 3? And I'll give you a few seconds to think about that response. Or if you coded it, just put it in the polling and be all set. Okay, let's take a look at how you responded. Looks like most of you thought he said all 3 words, 88%, well done. Let's take a look at what the answer is. And the correct answer is code 3. Mr. Miller repeated all 3 words on the first attempt, yet the order of the repetition does not affect the score. Okay, so how would you code C0300A, able to report correct year for Mr. Miller? Remember, the assessment date identified in the video was Tuesday, March 10th, 2020. Would you use code 0, missed by greater than 5 years or no answer? 1, missed by 2 to 5 years? 2, missed by 1 year, or is it 3, correct? I'll give you a few more seconds to consider your response for this. Okay, let's take a look at the responses here. Most of you thought it was 1, missed by 2 to 5 years. 91% thought that. And the correct answer is 1, missed by 2 to 5 years. Mr. Miller reported the year to be 2016, which is within 2 to 5 years of 2020. Okie doke. Now, how would you code C0300B, able to report the correct month for Mr. Miller? Is it code 0, missed by less than 1 month or no answer? Is it 1, missed by 6 days to 1 month? Or is it 2, accurate within 5 days? And that first response is missed by greater than 1 month. I think I said less than, but missed by greater than 1 month or no answer, just to clarify that. And I'll give you a few more seconds to consider a response for C0300B. Okay, let's see how you polled on that. Most of you thought it was missed by greater than 1 month or no answer, 95%. And the correct answer is indeed code 0, missed by greater than 1 month or no answer. Now, Mr. Miller did not report a month. He reported the season. So that's important to note that that's actually not a correct response at all. Okay, so now let's consider C0300C. How would you code C0300C, able to report the correct day of the week for Mr. Miller? Is it code 0, incorrect or no answer, or is it 1, correct? I'll give you guys a few more seconds to consider that. It's pretty easy response one way or another. Okie doke. Let's take a look at that polling. And most of you thought it was correct. And I know this one was tricky, right? Because he looked at the newspaper. So the actual correct answer is 1 correct. Mr. Miller reported it was Tuesday, an accurate report after looking at the newspaper. So yeah, even though he used that newspaper, that was still an accurate report. So that was okay. So this is how you would actually code C0300 temporal orientation for Mr. Miller. And how did you do? It looks like from the polling, I'd say most everyone had a solid understanding of this item. So let's move on to C0400 recall for Mr. Miller. How would you code C0400A able to recall suck for Mr. Miller? Would you use code 0, no, could not recall, 1, yes, after cueing something to wear, or 2, yes, no cue required? Now this is again, when the nurse asked him to recall those 3 items. And this item is broken down by each item, so the sub items in here. So we'll start with suck. What was his ability to recall suck? Okay, give it a few more seconds. Okie doke, let's see how we did with that polling. Most of you said it was 1, yes, after cueing something to wear. And the correct answer would be code 1, yes, after cueing something to wear. You might remember that Mr. Miller recalled the word sock after the nurse provided cueing something to wear. So how would you code C0400B able to recall blue for Mr. Miller? Would you use code 0, no, could not recall, 1, yes, after cueing a color, or 2, yes, no cue required? And again, this is his ability to recall blue, the word blue. And I think this one was a little tricky too. Give it a couple more seconds. Okie doke, let's take a look at those polling responses. Most of you said that he could not recall, so it was 0, no, could not recall. And that indeed is the correct answer, no, could not recall. Now, after providing a categorical cue, Mr. Miller stated that the correct word in a series of words. However, this would be considered an incorrect response, as Mr. Miller named multiple items in the category, even though the correct word was said within that series. But because it was said after providing that categorical cue, we really can't give him credit for that. So I hope that helps clarifies that concept that you're going to find in the guidance. Okay, so how would you code C0400C able to recall bed for Mr. Miller? Would you use code 0, no, could not recall, 1, yes, after cueing a piece of furniture, or 2, yes, no cue required? Okie doke. Let's go ahead and close that poll out and see how you guys did. Most of you said yes, no cue required. And the correct answer is indeed yes, no cue required. Mr. Miller recalled the word bed without the need for a categorical cue, so we would give him full credit for that. So here's what the coding for C0400 recall would look like for Mr. Miller. And again, from the look of all that polling, I would say you guys are doing pretty good, but let's move on, more coding to do, right? So the next item here we want to look at is the BIMS. I'm sorry, C0500, the BIMS summary score. So after you look at the coding of C0200 through C0400, you know, that's going to determine what your actual BIMS summary score shall be. So Mr. Miller's responses were coded as the following. C0200 was a 3, C0300A a 1, C0300B a 0, C0300C a 1, C0400A a 1, C0400B a 0, and C0400C a 2. So thinking about that, what is Mr. Miller's BIMS summary score? Now, I will ask again to help us consider our responses, if we could flip back to that previous slide so we can do the math. And then for polling, we're just going to provide you some response choices here. So is it A3, B10, C8, or D5? Okie doke. I think we're looking good here. If we can see that poll, most of you thought it 100%. Thought it was 8, and you guys can add. This is excellent. The correct answer is indeed 8. So by adding the values of C0200 through C0400, the BIMS summary score for Mr. Miller would indeed be 8. Okie doke. So now let's consider the coding of C1310, signs and symptoms of delirium from the CAM for Mr. Miller. Now, reflecting on the video and your notes if you took them, how would you code C1310A, acute onset mental status change for Mr. Miller? Is it code 0, no, or 1, yes? Did Mr. Miller present with an acute onset mental status change? You got to think about that one. Okay, let's take a look at those polling responses. Most of you said yes, indeed, 97%. And the correct answer is 1, yes. Mr. Miller demonstrated behaviors that signal an acute change in mental status. Based on his wife's report, these behaviors are new and represent a change from baseline. Now let's consider how you would code the rest of C1310. We'll start with C1310B and attention. How would you code C1310B and attention for Mr. Miller? Is it code 0, behavior not present, 1, behavior continuously present, does not fluctuate, or 2, behavior present fluctuates? And this question focuses on inattention, thinking about how Mr. Miller responded to that nurse during her questions, her interview. I'll give this one a few more seconds. Okie doke, let's close that poll and see how we did. Most of you thought it was 2, behavior present fluctuates. So let's see what the correct answer is. The correct answer is indeed 2, behavior present fluctuates. Now, Mr. Miller demonstrated difficulty focusing attention and keeping track of what was said. Based on his wife's report, these behaviors are new and represent a change from the baseline or his baseline. Okay, now let's take a look at C1310C, disorganized thinking. How would you code C1310C, disorganized thinking for Mr. Miller? Is it code 0, behavior not present, 1, behavior continuously present, does not fluctuate, or 2, behavior present fluctuates? And again, this is for disorganized thinking. And I know there was a lot that was going on in that video, so I appreciate you guys paying attention and giving this some real serious thought. Okie doke, give it a few more seconds. Okay, so most of you thought behavior present fluctuates, and the correct answer is indeed 2, behavior present fluctuates. Well done. Mr. Miller demonstrated disorganized thinking, including irrelevant conversation and switching from subject to subject. Now, based on his wife's report, these behaviors are new and do represent a change from his baseline. Okay, so for the final item in C1310, C1310D, altered level of consciousness. So how would you code C1310D, altered level of consciousness, for Mr. Miller? Is it code 0, behavior not present, 1, behavior continuously present, does not fluctuate, or 2, behavior present fluctuates? So again, consider, did he present with any altered level of consciousness? And I think the item itself gives you some ideas of what that could mean. So it's always good to read those items to help you answer the questions. Give it a few more seconds. Okay, let's take a look. So most of you thought that behavior was not present. And the correct answer is 0, behavior not present. Mr. Miller did not demonstrate any symptoms of vigilance, lethargy, stupor, or comatose behaviors during the assessment. So to review, this would be the coding for C1310 for Mr. Miller. How did you do with this exercise? So what does this mean for Mr. Miller? Really, that's what we want to get to. Based on this coding and considering the CAM assessment scoring methodology, Mr. Miller has an indication of delirium. Coding responses for C1310 indicate that these behaviors were present, identified as either continuous or fluctuating. So let's review some key insights for Section C items. Structured cognitive interviews, such as those found in Section C, are more accurate and reliable than observation alone for recognizing cognitive patterns. Structured interviews will efficiently provide insight into the patient's current condition that will enhance good care. Direct or performance-based testing of cognitive function decreases the chance of incorrect labeling of cognitive ability. That's all I have for Section C. I hope you found this presentation helpful. Thanks so much for participating.